My name is Paul Shin. I'm a GI and HPB surgical oncologist, trained here at St. John's and practicing minimally invasive liver pancreas surgery. In addition to using the Da Vinci Xi robotic platform to perform multi-port liver pancreas surgeries, I also am very much interested in minimally invasive and non-invasive liver-directed treatments. And so one thing I've been doing here since being hired has been growing our histotripsy or ultrasound-based liver-directed therapy program. For me, this is all part of being a thoughtful, modern liver pancreas surgeon who has sort of all tools available to him. That includes surgery, ablation, and now ultrasound-based technologies. I came from New York City, where I did my general surgery residency at New York Presbyterian Weill Cornell. It gave me a great foundation in surgical oncology. I spent 2 years in a postdoctoral research lab at Memorial Sloan Kettering and really learned a lot of the foundational principles of how I manage liver pancreas cancers. Since coming out here to Santa Monica, I've taken that to the next level using minimally invasive technologies and approaches that I learned in the open setting in New York and now getting to apply here using the robotic platform. What we're considering now is how to apply the robotic platform to increasingly complex liver pancreas operations. I think this is really exemplified by both efforts in the nation for folks to be doing robotic pancreaticoduodenectomy as well as robotic hepatectomy. The difference, I think, is incredible. Now, instead of a week-long hospital stay that ends up with a skilled nursing facility where you're waiting 3 months to get onto adjuvant systemic therapy for pancreas cancer, with a minimally invasive Whipple surgery or a minimally invasive hepatectomy, you are really minimizing the immunosuppressive effect of an open operation. You are increasing the speed at which patients recover. You are decreasing the time from surgery to receiving adjuvant chemotherapy. And so it's really a quite simple proposition of doing better oncologic surgery with smaller cuts in the service of patients. And really, I think that is the guiding philosophy of this institution as we enter into the next several decades. One of my tasks here as a junior faculty member has been to really bring our program into the modern era in terms of teaching fellows how to operate using the latest minimally invasive techniques, as well as using some of the new insights in liver surgical anatomy to help perform safe and oncologically sound parenchymal preserving liver operations. Histotripsy is essentially an ultrasound-based non-thermal technology for treating liver tumors. One of the biggest tools that I think is helpful as a liver surgeon is the use of intraoperative ultrasound. And so over the last 5 to 10 years, I've really taken it upon myself to become an expert in the use of ultrasound technology, and histotripsy represents the sort of furthest realization from a pure diagnostic modality to being able to treat using sound waves. And so not only do I feel that my training and background in intraoperative ultrasound, not only is that helpful for performing liver surgeries, it also has given me the building blocks for performing histotripsy and using that ultrasound technology in a thoughtful way. So I think I'm uniquely qualified to speak to why one should consider coming here for surgical oncology fellowship. I graduated from this program last year, just a few months ago, and was super excited to stay on as faculty member, mainly because I see a lot of potential in our institution and in the local community here in Santa Monica. I am not only a surgeon, I'm a dad of a 9 and a 5-year-old, and what I can say is raising my 2 young kids here in Santa Monica, being able to walk them to school before I come into work, has made a huge difference in terms of work-life balance, something that I definitely struggled with in New York City, where the pace of life is a little bit more intense. And so for me, I would thoroughly recommend coming out here to the West Coast if what you're interested in is kind of a work-life balance, really focusing on innovative care in the advanced cancer setting. In many ways, this is in keeping with the tradition and pioneering spirit of Don Morton, who really took axillary lymph node dissection in melanoma and tried to find a better way, a more innovative, a less invasive way to stage the nodal basin. And it's sort of that principle that has led us into the modern era of surgical oncology care, whether it is parenchymal preserving hepatectomy, where we're no longer dividing liver into left and right simply, but really trying to cone out functional units of the liver so that patients can represent for subsequent liver-directed therapies. And so in many ways, what we're doing here today with the robot in the liver pancreas world is really just a reflection and extension of the spirit of our founding father, Don Morton. So look forward to meeting you all and answering any questions you might have.